You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to a brand new season of the RN Mentor podcast. I'm super excited to be joined today by Dr. Sheldon Fields. I'm going to say Dr. Fields is a repeat offender from the fact that he's been on the show before, and I'm super excited because he's in another role that I'm excited to talk to him about specifically. Before we get into that, I'm going to share his bio with you. Dr. Fields is a research professor and inaugural Associate Dean for Equity and Inclusion in the Ross and Carol Nese College of Nursing at Penn State University. He is also the founder and CEO of the S.D.F Group, LLC, a health innovation consulting company. He has over 30 years of experience in the healthcare sector as an educator, researcher, clinician, administrator, consultant, health policy specialist, and entrepreneur/business owner. Dr. Fields is a well-known and respected HIV/AIDS prevention research scientist with a significant focus on young men of color. He is an advanced AIDS certified registered nurse and a board-certified family nurse practitioner. He worked for over a decade as a primary care provider in a federally qualified health center with historically underserved disenfranchised populations. He is a lifetime member of the National Black Nurses Association and is the organization's current and 14th national president. He was the first ever male registered nurse selected for the Robert Wood Johnson Foundation Health Policy Fellowship Program, in which he served as a policy advisor to then Senator Barbara Mikulski on the Senate Help Committee during the historic healthcare reform debates and passage of the Affordable Care Act. Dr. Fields is a fellow of the American Academy of Nursing, the American Association of Nurse Practitioners, and the National Academies of Practice. He is a former dean of the Mervyn M. Dineley School of Nursing at Charles Drew University of Medicine and Science, and is a former dean of the School of Health Professions at the New York Institute of Technology. He has other academic and administrative positions at Binghamton University, University of Rochester, Florida International University, and Long Island University, Brooklyn. Dr. Fields received his PhD in nursing science from the University of Pennsylvania, his MS in family nursing, and his BS in nursing from Binghamton University. He completed his postdoctoral work in the Center for AIDS Prevention Studies at the University of California, San Francisco. Welcome back to the show, Dr. Fields.
Thank you, Ali. Thank you for having me back. Every time I hear that bio, I kind of look around and I wonder who they're talking about. But I am a man of a certain age, and I've been blessed to have done a few things, and I'm absolutely excited to be here with you again.
Amazing, amazing. Now, you and I, well, you go to a lot of conferences, and I've had the pleasure of meeting you in person multiple times, and we've had these great discussions. And when you became the president of the National Black Nurses Association, and I believe you were the previous vice president, correct? Correct me if I'm wrong.
I was the first vice president for 2 terms, yes.
Excellent. So I know you were running for president, and I was so excited to see your name pop up as the new president for NBNA. And when we had talked, I think I approached you to say, come back on the show, and you had the same thought that you need to come on the show and really talk about the NBNA, because we haven't, believe it or not, I have not had the opportunity to have any previous presidents of NBNA on the show, and I'm so excited that you are the first to come and speak on the organization, which is so valuable. If any of my listeners are haven't, if you haven't heard, please go back and find Dr. Fields's previous recording, because he talks about his career and his passion with the work that he does with NBNA. But in his new role, I really want to dive in a little bit more into the NBNA. With that said, Dr. Fields, again, welcome to the show, and let's talk about the National Black Nurses Association. And if you can start with a little bit of a history of the National Black Nurses Association, because I think its inception is so much like key to the conversation for the rest of the conversation we're going to have.
Oh, I'm always delighted to talk about NBNA, as we affectionately refer to it as. And I'll start by saying this, Ali. I go a lot of places and oftentimes I get this question that goes something like this: Dr. Fields, why does there need to be a National Black Nurses Association when we don't have a National White Nurses Association?
Mm.
And I will tell you that I'm so well prepared for this question. I usually take a deep breath and I say to the person who's asked me the question, I said, let's talk about history, which you are not probably fully versed in. And let's talk about the history of the American Nursing Association, that for decades excluded the membership of all nurses of color. So when you exclude nurses of color, the only people you have left in the association are white nurses. So whether the American Nursing Association called itself the White American Nursing Association, that's exactly what it was.
Right.
And the National Association of Colored Graduate Nurses, which was the forerunner for nurses to represent nurses of color, they petitioned for years to be full members of ANA, and they kept being denied. So around the 1950s or so, there was a deal struck. The ANA finally said, okay, fine. We will let you all become full members of ANA with the agreement that you dissolve the National Association of Colored Graduate Nurses. So that was done. And would it surprise you that during that time that they took their dues, which I believe was $2 or $3 at the time, which, that was a lot of money then. But full membership never really came to being. They were not allowed to hold leadership positions. They weren't allowed to hold office. They weren't allowed to fully participate. So you take my dues money, but you don't let me participate. So we roll into, of course, the civil rights movement. We get into the late 60s, early 70s, and a brave and phenomenal, absolutely phenomenal group of Black women at the time, leaders, they were like, well, if you're not going to fully let us participate, then we need to form our own association to take care of our needs and the communities that we care about. That was part of the foundation and the founding officially in 1971 of what became the National Black Nurses Association. We are now 53 years old. We have over 111 chapters in 34 states, including the District of Columbia, and we have thousands of members. And I have the honor and the absolute privilege of serving as the association's 14th national president. I am the second male to ever serve. The first male president was my fabulous mentor, Dr. Eric Williams, who actually, Ali, you might want to have Dr. Williams on because he has a lot more of that history. But I am super excited about where we are. I took over and started my presidency at the end of our annual conference this past August in the city of Atlanta. So I am, what is that? August, September, October, November, December, January. I'm 6-7 months in.
Yeah. Very cool. Very cool. Well, congratulations. Again, I was super excited to see your name pop up as the well, actually, I wasn't surprised to see your name pop up as the new president for NBNA. So, but I was still delighted to see that. Um, can we talk about how does, for example, your presidency is your president? How did your presidency start? And how's it going to look different than the previous presidents of NBNA? What are your goals?
So I want to first say that NBNA, again, I'm the 14th president. NBNA has had 13 other phenomenal leaders, all of whom helped to advance the mission and vision of NBNA. I'm delighted that my colleagues have given me the privilege. I consider myself to be a servant leader. I think that's very important because it's not about me, Ali. It's about the association, the members we serve, the communities and the programs that we foster. So I mentioned that we're now 53 years old. So one of the things that we are doing with the advent of my new presidency is we are looking towards the future.
Mm.
And when I say the future, we are really looking to ensure that NBNA is around for the next 50 years and the next 50 after that. So we got to lay some foundational things. We have to really focus on how do we get there? How and looking at if we have the correct internal systems, what do we need to update? How do we grow our membership? And how do we leverage our partnerships? That's all really incredibly important. So there are 5 things in which I'm going to focus on. Resources. We must have resources, human resources and financial resources. One of the main things that we've been able to do within my first 6 months is we stood up an intense national search for a new executive director. Our previous executive director had served NBNA for well over 20 years. And we took our time to really find our new leader. And I am so excited that we've been able to hire. Her name is Miss Tanya Jackson. And she is currently onboarding as our new executive director. And we are just so honored to have Miss Jackson join us. That was one of our main things that we really needed to put in place because we needed to have someone that was going to be there in our national office, which is right outside of DC in Silver Springs, Maryland, to run our day-to-day operations and to direct our staff. And I, of course, will work in conjunction with our new executive director. One of the other things is our continued advocacy and our policy work. Dr. C. Alicia Georges, who was a former president of NBNA, during her presidency, started our Black Nurses Day on Capitol Hill. And that day happens on the first Thursday in February every year. That's our day to coincide with the beginning of Black History Month. So this past February 1, we celebrated our 36th annual Black Nurses Day on Capitol Hill. Wow. If you go to nbna.org and you look at our policy tab, you will see the 7 legislative agenda items that we advocated for, one of which is Black maternal health and infant health, which is one of our major topics. And we also stood up a brand new task force on Black maternal health, and we're going to have our first Black maternal health virtual conference February the 23rd and the 24th, so it's coming up. But that advocacy work that we do is very important because we hold our elected officials accountable to the work that is important to us around healthcare disparities. So we will definitely strengthen and continue that work. And we will be there for 37th, 38th, 39th, 40th. We will keep going as long as there's a need for us to have advocacy and foster political awareness. I mentioned our programs, and we have some signature programs that we stand up. We have a program all dealing with women's health, and of course, the subcommittee on Black maternal health. We have something called the Mini Nurse Academy that was the brainchild of the 13th president, Dr. Martha Dawson. And in that program, we take a learning program into elementary school and we teach the elementary children about nursing. And we expose them to nursing. It's a brilliant way to educate people about what we do and really plant the seed for those children who might want to become nurses who just have never been exposed to nurses. So that program is going strong, and we're going to expand that program. We want to get to more and more children a lot earlier to talk about what we do. And I already talked about Black maternal health. We have programs in psych mental health. We have a huge program dealing with substance use and abuse. We are national partners with Tobacco Free Kids, and we do all kinds of program around smoking cessation and the harms of tobacco and how the tobacco industry unfairly and unduly targets communities of color. And we all know that cigarette smoking is so very detrimental to your health. So those are just a few examples, and we are always looking to expand our programs and effective programs. So we're always looking for more. We stood up a reimagined NBNA because coming soon, NBNA is going to have a brand new national website. We are automating all of our processes, and we are looking to completely go paperless with the things that we do, become more eco-friendly, more swift and quick about the things that we're able to turn around. So we're looking to automation. You know, how does AI and how does our social media platforms fit into what we do? Because, you know, one of the first things that people do when they go to look for organizations, they go online. So that online presence is really important. So we're enhancing all of our social media. With our educational programs will also come the offering of continuing education hours so that nurses can get hours to, you know, be able to recertify in all of the specialties that they are involved in. So all of those things are really important as we move forward. So that's a quick overview of where we're going. Really excited about NBNA's future.
Great. Thank you for sharing that. Sounds like you have your hands full. Now, you touched on something that triggered a thought in my brain. Uh, and I know I'm putting you a little bit on the spot, but do you know the percentage of Black nurses in the US? And is there a strategy in the works to increase those numbers
Yeah.
so it's more representative of the population?
So we know that in the number, quite honestly, the percentage of nurses that are Black or African American, Black being a larger term,
Right.
is only about 12%. And that percentage has not changed in the last 3 decades. It really hasn't. So there's somewhere between, we gather 300 to maybe right below 500,000 when you add in the number of nurses that are not only RNs, but also LPNs.
Right.
Because the National Black Nursing Association offers membership to nurses at all levels. It
Excellent.
doesn't matter. We have membership for those who are RNs, LPNs or LVNs based on the state that you're in. And we have, you can join NBNA as a student because we also have scholarships. And that's the other major platform is to expand our corporate partnerships. We have several corporate roundtable sponsors, corporations that really support the mission and vision. And we have a very robust scholarship program. At our last conference, we gave out well over $300,000 in scholarships.
Wow.
And we will do the same this coming year. Actually, if you go to nbna.org and you're a student who's a member, the scholarship application is open.
Oh, excellent. Fantastic.
So, but that percentage, though, back to the original question, Ali, that percentage of nurses has not grown. And the number of Black nurses do not mirror the number of Blacks in the population of the United States. And it doesn't for most minoritized populations, with the exception of Asian populations. But even that's a misnomer, because when you look at and you break down into the various subcategories, they lump Asians into this one large category, and that's just not right.
Right.
But once you break them out into the various, intra-ethnic groupings, even they do not mirror their size in the population. And the number of Hispanic nurses is quite low as well. And mind you, we work with all of those other groups because Dr. Betty Smith Williams, who was one of the founders of NBNA and NBNA's seventh national president, she helped to found an organization called the National Coalition of Ethnic Minority Nursing Associations. And that includes NBNA, it includes NAN, the National Association of Hispanic Nurses, NINA, which is the Native American, Native Alaskan group. It includes APINA, the Asian Pacific Islander Nursing Association, and it includes PNAA, the Philippine Nursing Association of America. Those are the 5 main groups. And we work together in coalition because historically, all 5 of those ethnic, minority, and racial groups have one thing in common, Ali. We've all have historically had issues with the United States federal government.
Wow. Yeah. Very true.
And that's what binds us together.
Yeah.
That was the original idea behind the founding of NSEMNA. And we have a national policy conference coming up in Los Angeles,
Yes.
March 15th.
Yes,
so if you
yes.
look at mynsemna.org online, you can find that information for our upcoming policy conference that we're doing with NSEMNA.
Yeah, and that's going to be at the Endowment Center in downtown LA.
Yep, the California Endowment. Yep.
So if you're going to be there, Dr. Fields is going to be there, and I'll be there. So you get to meet both of us. So
yes, yes.
So
Yes.
excellent. Thank you. I was gonna plug that piece in, but you brought it up, so thank you for taking that off my plate. Now, question for you, as we're looking to, like I said, increase representation within a lot of different communities within nursing, because we have been historically white and female. But from your perspective, what is your strategy in strengthening your association with membership? Because nursing has historically not had a good turnout when it comes to these nursing organizations. For example, the American Nurses Association has, like, I think it's something like 400,000 members or so, but it's a small fraction of the larger nursing population. What is your strategy in bringing in nurses into your organization so you have a larger membership and larger influence?
Yeah. So again, remember, we have membership at all levels.
Right.
And one of the ways in which we definitely are looking to increase our membership is through that scholarship program that we talked about.
Right.
I don't care where you go to nursing school at, and I don't care what color you are, nursing school is expensive.
Right.
I know here at Penn State, our nursing undergraduate students graduate with the highest debt. And again, that's irregardless of race. But we do know for minoritized or historically underrepresented students who don't necessarily have the resources that their white, wealthier counterparts have, they take on even more debt.
Right.
So we are really trying to alleviate some of that debt through our scholarship program. And like I say, if you join NBNA as a student, we're able to provide some resources. Then you continue to grow with us and you stay with our association throughout your career. We have a very robust mentoring program, and we mentor at all levels. and it's growing. And that's another way to attract people, because people need mentorship at all points of your career. It doesn't matter at what point in your career. People are really, I think people are surprised when they find that even myself, I have mentors. And I'm like, absolutely, I have mentors. I will always have mentors. You know, we all continue to grow. We are standing up a membership drive. We have a really great membership committee. It's really spearheaded by our second vice president, national vice president, Dr. Marsha Lowe. Currently is doing a phenomenal job with our membership committee. So we have things like internal competitions amongst the chapters to get their members to renew, and we give awards for that and recognition. We have a membership drive. My moniker is that every nurse is an NBNA nurse. Each one bring one. Each one touch one, bring one.
Yeah.
And I tell people all the time, if all of the current members just committed to bringing one person to membership,
Right.
we double our size.
Exactly.
Then if we do it again the next year, we double our size. So it really doesn't seem that hard, but I will tell you that I still go places and people say, well, I've never heard of the National Black Nurses Association. And I always cringe. I'm like, how is that possible? And what are we still not doing? Why do you not know we exist? We've been here for 53 years.
Right.
But it is the case. And it doesn't surprise me, quite honestly, in a country where they're banning teaching Black history, the founding of NBNA is Black history. So of course they don't know we exist. And in some of those places and spaces where they don't see us. So again, through that Mini Nurse Academy, getting people to know about the fact that Black nurses exist and that we're here to support them at all points of their career, giving them scholarships, mentoring them through, and doing an active outreach. That's why we really are going to stand up a new robust website. We're going to increase our social media outreach. We have some phenomenal younger members that are out there doing some things on social media, Instagram lives and Facebook lives, and putting stuff up on TikTok. Dr. Fields isn't doing any of that without some guidance from those younger members. But they are reaching they're helping us to reach that next generation. That, quite frankly, is living their lives, via social media.
Yeah.
So we're doing all of that. And, sometimes the best recruitment, Ali, is word of mouth, person to person. I talk about NBNA wherever I go. I'm a walking billboard for NBNA. And as the national president, that's part of my job. And you'd be surprised when you start talking to people in a restaurant, a coffee shop, just about their health, and you let them know you're a nurse, and inevitably they're going to say something like, oh, my sister's a nurse, my aunt's a nurse, my mom's a nurse. And my next question is, particularly if they're Black people or people of color, I'm like, are they members of NBNA? and when they tell me no, I'm like, well, you know what? Tell your mother, your cousin, whoever it is, and I give them my business card, that you met the current president and that he wants them to email him or call him, and we're going to talk about membership in NBNA. And you'd be surprised how many people take me up on that.
That's excellent. That's excellent. Now you bring up a couple of points, and I want to touch on both of those. How do you keep an organization that was founded on the fact that you were excluded from the American Nurses Association? How do you keep that space safe for your members in order, as we look at some individuals like myself who consider myself an ally, right? But I'm not. If you look at me, I am not Black. So how do you keep those spaces safe for your members, when individuals like myself try to become allies or support organizations like the NBNA and National Association of Hispanic Nurses and so on and so forth.
Yeah.
Because we're at some point somebody's about to, going to put their foot in their mouth and make that space no longer safe. So what do you do? What do you do to keep those spaces safe and
So,
educate people like myself in order to make sure we're not, um, we have an awareness, right?
so I'll say this, and I'll answer it two different ways. There is a difference between someone being an ally, because quite frankly, Ali, we need allies.
Right.
We don't need to be doing this work by ourselves, because the work of diversifying the profession, the work of getting to health equity is not just the work of Black nurses, it is the work of all nurses. So we absolutely need allies, we want allies, we welcome allies. So I will tell you what I said to a member of NBNA when I was talking about when I was running to become NBNA president, and talking directly to the membership. And this is a member who happens to be white, who is a member of one of our chapters. And the question from the member was, Dr. Fields, um, uh, I am white and I'm a member. How do I get and talk to my other colleagues about becoming members? One, I said, I'm glad you're a member, and I want to be clear about something, and I'll be clear here. If you believe and you can support the mission and vision of the National Black Nurses Association, you are most welcome to join us. While we are an association that is focused on the upliftment of communities, such as Black communities and other communities of color that have been historically underrepresented and disenfranchised, our membership is open to everyone. The only thing is, if you're going to become a member, then you're saying to me that you believe and you will support our mission, vision, our values, and our focus. And I think you need to have a healthy respect for Black history.
Mm.
If you can do all of that and you pay your dues, and that's important. You got to pay your dues.
Gotta pay your dues.
You are
Yeah.
most welcome.
Yeah.
But we also have members that belong to all of the ethnic and racial groups that are our allies. And we need them. Like I said, we work with NSEMNA, we work in that coalition. We're allies, we support each other.
Right.
And we will always do that. We will always do that, because that's also very important. Our struggle in the United States for equality and is very similar to other groups. So there is some overlap. And just recently, I mentioned the Black Nurses Day on Capitol Hill, our political advocacy day. The National Association of Hispanic Nurses has also now adapted an advocacy day, and they have overlapping days with us. We welcome that. The Haitian American Alliance International, they just held their first advocacy day one day before ours. We welcome that. We work in coalition. There are some very specific issues that people want to advocate for, as do we. And there are also those things where we have overlap, we will absolutely partner. But my white colleagues out there, hear me well. You are welcome in the National Black Nurses Association.
Great. Thank you. I appreciate that. Now, you mentioned another thing around Black history,
Mhm.
and I know you and I have talked about certain states that are trying to erase Black history, sort of say.
Yeah.
And I want to feel like I was one of the first ones to commend you on not you, but the organization NBNA for choosing to move venues for their upcoming conference. Why don't you share what NBNA did and the decision behind it?
Well, thank you for this question, Ali, because I think it's really important because it was one of the first things that, as the new president, I had to guide the board through. And I'll give you a little background. And this is also on our website through our YouTube channel. I did a whole national conversation directly to the membership because I'm also very clear. We are a member-driven association. I am a representative and again, a servant leader. So here's what happened. Our conference in Hollywood, Florida, was originally scheduled for, I believe it was either 20 or 21 during one of the COVID years. We had to, of course, like everyone did at that time, move our conference because you couldn't have a conference in the middle of COVID. So the conference was rescheduled, and it was rescheduled to be held in 2024. Now, we could not have imagined back in 2020, 21, when these decisions were being made, that the political environment in the state of Florida would be so contentious and, quite honestly, downright hostile to Black people. The governor of Florida has issued a lot of anti-DEI, anti-Black legislation. They are banning the teaching of Black history in schools. They banned DEI officers and DEI programs in all of their publicly funded universities. There was a racialized killing at a Dollar General in one of the locals in Jacksonville. And it was hate motivated. So given all of that, I am first and foremost also a classically trained researcher, and I don't do anything without data. Thank you to the University of Pennsylvania for the wonderful PhD education that I did receive. So I went to the board and I said, I'm going to put a survey out to the membership, and we're gonna poll them about their feelings and what they would hope that we do with regard to holding the conference in Hollywood, Florida in 2024. We got the survey results back, and to the question, should we move the conference? It was something like 84% of the membership said move the conference.
Wow.
We will not come, we will not support it. We have concerns for our safety.
Mm.
Given that very clear directive from our membership, the NBNA Board of Directors, let me be very clear, not Dr. Fields, the NBNA Board of Directors chose to vote to move the conference out of Hollywood, Florida. And we were very fortunate to find that the city of San Francisco was able to take up our conference. So we will be at the Marriott Marquis in San Francisco, California, July the 23rd through the 28th for our 52nd annual Institute and Conference. Again, go to nbna.org. Registration is open. The exhibitor booths are open. Abstracts closed today. I think we might be persuaded to extend it by the time this airs. But we are so super excited about moving the conference. We have not held a conference in San Francisco in 2 decades. It really has been 20 years. And we have 3 major chapters that are supporting the conference in the San Francisco area. We have our Capital Cities Black Nursing Association, which is out of Sacramento. We have the Bay Area Black Nurses Association, which is out of Oakland, right across the bay. And we have our Stanford Health Black Nursing Association, which is based out of Stanford Medicine, which one of the other phenomenal things that happened shortly after we decided to move the conference, Stanford Health, Stanford Medicine became our first Diamond Plus sponsor to the
Wow.
tune of $100,000 plus. And we are
Wow.
so thankful to Stanford for that type of initial support. And again, we are looking forward to the conference. It's going to be one of our largest. I just know it. And again, registration is open, and everyone and anyone is welcome to attend an NBNA conference. Again, as long as you can understand that our focus is on those health disparities issues, and you can get with the theme of our conference, which is surrounding issues of health equity, you are most welcome to join us. We have a really good time at our conference. We really do know how to mix our learning activities with our programming activities, with those activities that honor our members. And again, we're going to give out hundreds of thousands of dollars in scholarships.
That's excellent. Thank you. Thank you for sharing that. And again, I was very pleased to see that. And I want to say I continue to be disappointed by some other organizations that are still going back to states that have continued to show themselves through their policy and laws that they are discriminating against very specific minority populations.
Yeah, but one of the other things, and if you look at the national webinar that we did, and we polled our members, we said, would you still want us to move the conference, understanding that NBNA is going to take a financial hit?
Yep.
And I was very clear with the membership. We are looking at a $500,000 financial hit.
Wow.
So one of the other things that we're talking about is how do we partner with corporations and other entities that want to support us to pay that cancellation fee for that facility in Florida. And we're still looking for help to do that. If anybody wants the help to do that, simply, go to nbna.org. You can make a donation right online. You can contact me and we can talk about other ways for you to help us to mitigate those costs. But this could not have been about money, Ali. This was about member safety.
Right.
And God forbid we held our conference in a city, in a place that we knew was hostile to Black people, and something happened.
Yep.
And there is no value. There is no monetary value that you can put on a member of NBNA. There just isn't. So we will deal with this. And one of the other things that people should know about NBNA and about Black people in general, we are deeply spiritual. And people have heard me say this before. God has brought this association through 53 years. He did not bring us this far to leave us. And I do not believe that we will have any issues mitigating whatever those costs are in Florida.
I agree. I agree with you. It was done for the exact very good reasons that you mentioned. So I appreciate you sharing that and actually leading NBNA through this process. So thank you. And if anybody is interested, as Dr. Fields mentioned, if you're going to donate, I'll put links on my website to the NBNA. So you can just, if you go to the RN Mentor podcast website, I'm more than happy to share those links with you along with this podcast. I want to make sure that we're almost out of time. I want to make sure that we leave with any last words from you that you'd like to share with the audience at this time.
So I'll say this, as we imagine and reimagine what NBNA will look like for the future, we really are sincere in our hope that people will see us not only for the things that we do, because we organize nationally, we act at the local level through those 100 plus chapters. And we look a little different in every city where we're at, because we really do empower those local members to take our national programming, give it their own flair, if you will, their own personal touch, to make it work effectively for the communities in which they are actually immersed in. And we do welcome partners. Like I say, we're looking to grow our corporate sponsorships. If you look at our corporate roundtable list that's currently on our website, we've had phenomenal relationships with some very well-known companies, CVS and J&J. Pfizer has been a long-term corporate partner. Vitas Healthcare has been a really great partner to us for over 20 years. And we continue to work with our partners to grow, but we always are looking to expand. So if there are other corporations out there, other people who really want to partner with us, we are open to those conversations and discussions. The last thing I will say is this. The work that NBNA helped to do with the movement for racial reckoning that Dr. Ernest Grant stood up when he was the president of the American Nursing Association. And I have such respect for Dr. Grant, who most people should know was the first male president of ANA in its entire 100-plus-year history. He just so happened to also be a 6'6", 6'7" Black man. And he was the third Black president of ANA, following, of course, the great Barbara Nichols, who was the first Black president of ANA. Ernest, Dr. Grant, really did some phenomenal work, and he's continuing to do that work. And NBNA was a founding participant in that commission's report. And we're still at the table trying to work this out, because as the largest healthcare members of the healthcare profession, if we can't get it right as nursing and we can't figure out how to work together across the racial lines, then we are going to continue to disserve all of American society. So we are committed to that work. I just want to make sure people understand that, but it's tough work. And it's work that, a lot of people are vested in, but we still have to get it right. So again, join us, help us in all that we do, because again, the membership of NBNA is open, and I really do hope to see you all at our national conference. Once you come to our conference, you will understand why people continue to come back to NBNA. And I know what I meant to say. Dr. Grant, being the third Black president, followed both Barbara Nichols and the phenomenal Beverly Malone, who was the second Black president of ANA.
And she's now associated with the NLN.
Oh, she's the president of NLN. She's been there for years.
Yes, and both for our listeners, both Dr. Malone and Dr. Grant have been in previous podcasts. So if you want to hear their stories, they are both amazing individuals. So I'll leave it at that. All right. Well, thank you so much, Dr. Fields. I look forward to seeing you in March. I just have to drive downtown. You have a flight to catch for that for that one.
I look forward to seeing you, Ali. I do. We'll hang out in LA.
Yes, definitely, 100%. All right. Well, appreciate your time. Thank you for our audience for coming back for season 9. And I look forward to bringing you more incredible guests this season as we continue to look at our profession through the eyes of some incredible individuals like our own Dr. Sheldon Fields. Thanks. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources. And don't forget to subscribe. Until next time, I wish you fair winds and following seas.